Cambodia is a tropical country in Southeast Asia with a population of over 14 million people. Its modern history has been very turbulent, including most notably the Khmer Rouge genocide from 1975 to 1979.
2 million people were wiped out. 2 million people were killed out of a country that was then only 8 million people. And it was the leaders. And so since then, there's been this generation gap of leadership in the country.
Most of Cambodia's population lives in rural areas where there is virtually no reliable, competent health care available. And most cannot access or afford health care in the cities, where a simple doctor's visit can cost more than a week's wages.
If you're only making $1 or $2 a day, and you have to spend $2 just to get to the place for health care, you've already spent a day's wages just to get there.
As a result, those who are sick will often not seek medical treatment until their symptoms are severe enough that there is no other choice, resulting in many unnecessary complications.
What we see is patients unwilling to go to the local doctors to spend any money, so by the time they come to our clinic, they have let their disease process, they have let their illness go far beyond what it should.
Compounding this challenge is the widespread lack of education in basic community health, causing Cambodians to suffer from preventable disease.
1 in 7 children in Cambodia die before their 5th birthday. And it's estimated that 71% of people in Cambodia do not have reliable access to clean water. So we look at those numbers and remember that those are people, and we want to show God's love to these people.
In 2000, Cooperative Services International and a group of organizations and churches set out to help change this with the creation of a referral clinic in the capital city of Phnom Penh. Their mission was to proclaim Christ's mercy, to provide excellent health care, to prepare local healthcare workers, and to partner with like-minded workers. CSI's Mercy Medical Center is now a multi-organizational, multinational partnership with a network of over 30 referring partner organizations. Together with this network, Mercy Medical Center has been carrying out its mission since 2000. They have treated tens of thousands of patients, taught hundreds of medical and nursing students and residents, and seen lives transformed. This partnership also provides opportunities to share the good news of salvation in Christ.
We care for all people. It doesn't matter your religious background, it doesn't matter where you're from, we take care of you.
And then it's a wonderful opening to share the gospel, and which of course is our passion to do, is not just to heal people, but to also present them the opportunity to have a new life in Christ.
Well, since April, we've seen more than 50 people come to Christ through the Mercy Medical Center. We've got one church that's being planted because of the Mercy Medical Center.
During their visit to the center, patients are given basic hygiene and preventative medicine education. And while they wait to be seen by a doctor, they're given the opportunity to hear the story of the gospel from a Cambodian-led spiritual impact team who is always ready to share more with those who are interested. Meeting or exceeding World Health Organization and Cambodian Health Ministry guidelines, MMC is able to provide quality health care at minimum cost. MMC also works with various local churches and missions organizations to provide follow-up care for its patients, a critical element of healthcare in such a rural environment. But there have been some setbacks. In June of 2008, CSI Mercy Medical Center was forced to move out of its rent-free site at a military hospital and began leasing an unused orphanage as a transitional facility.
The space is very limited, and especially if we want to have a training center where we're training healthcare nationals, we need to have more space to be able to see a greater amount of outpatients.
Storage space is also very limited.
This whole area on the roof of the facility is storage mostly for our surgical supplies because we can't do surgery here in this facility, and it's one of the reasons we want to have a new building.
Currently, the center does not have its own operating room. Surgeries are being performed in limited numbers at the local hospital.
One of the big problems that we've run into is the public hospitals that are available some of the sterile technique is not optimal. Also, post-operatively, there seems to be some difficulties in care for the patients.
In August 2009, more than 3,700 square meters of land was donated to build a new Mercy Medical Center, one that will provide an appropriately sized facility for training as well as high-quality medical surgical care and allow MMC to grow their ministry of partnering with missionaries, churches, and aid organizations throughout Cambodia.
Many pieces have fallen into place already. We've had Christian architects and construction project leaders come on board, and drawings are in place, designs are in place for this new facility, but we are right now needing to raise funds to make it happen.
The combined partners of MMC, led by the Board of Directors, are proposing a $1.2 million capital campaign to build and equip a new center.
This center will give us the capability to expand our outpatient so that we can train nationals well, to have 2 ORs, to have inpatient.
And it will do it all in an area that is poor and just on the periphery of the city. We are confident that God will provide what we need for that. We also are confident that we'll be able to expand over the long term and be able to continue to provide care for people in increasing numbers, to increase the impact for Christ in Cambodia.
The vision of Mercy Medical Center is to see lives transformed through quality holistic health care in every province of Cambodia. This cannot happen without the ongoing partnership of supporters. Please consider how you might help support the mission and ministry of Mercy Medical Center. Thank you.